My name is Eric Okoth. I'm a physiotherapist by profession, partnering with Ponea Health. So today we like to let you understand what physiotherapy basically is, what we do, and when you may need to visit a physiotherapist, and also to help understand or answer few or all the questions that are frequently asked pertaining what physiotherapy basically is. So there are also some, depending on how the patient is doing, you can choose to either stop the physiotherapy sessions only when the patient is well, because the aim is to now restore. Once you've restored or once you've maintained the mobility or you've achieved your goal as a physiotherapist. If it was pain that the patient had presented with, the patient is now pain-free. If it was a limited motion of the joints or something, the patient now has a full joint range of motions. Then it means the physiotherapist has now achieved the goal and the patient is now pain-free or the mobility has now been restored. In that case, we now discharge. Or we may stop physiotherapy sessions when there is no much good prognosis, when the patient is not, we don't see that the patient is recovering. For there, we may halt. We don't stop, but we hold on the physiotherapy sessions so that we may refer for further investigations. In this case, if the patient had done an X-ray and you ruled out there's no any skeletal injuries or something, we may refer further for MRI or the scans that may now rule out if the problem there is a soft tissue injury, or there is maybe for the patients who present with the severe pain on the back or radiating to down the legs, is there nerve impingement, then from what level, then what is causing the nerve irritation or such. So there we may stop for a while, refer the patient for an MRI, so that the patient comes with that. After that, you may resume the physiotherapy sessions after getting to know what exactly the problem is, or you may refer for further treatments for conditions that may require surgery, because we don't, physiotherapists don't work in isolation. We work interdisciplinary. So when you see the patient is not progressing after all the scans, you think as a physiotherapist that this is a patient that may need a surgery or another specialist, so you refer. The prognosis, or rather the recovery process or the recovery journey, depend on the patients, and also some patients with the paralysis. Some recover fully depending on what was the cause of the paralysis and also what timeline. When did you sort for, or when did you start seeing a physiotherapist? And were you subjected to the right treatments? So in that case, the patient may recover fully after paralysis, or the patient may not recover fully depending now on the time that, just as I've said, when did the patient started treatment. And also, as because we don't work in isolation, as I said before, when you work closer to other medical doctors to find out what is the cause of the paralysis, the neurologists, you work with everybody, so that in the health profession, so that we help the patient recover. So when the patient starts physiotherapy early enough in cases of paralysis, there's chances of full recovery. Thank you so much for joining us in this discussion. We are looking forward to engaging you and interacting you a lot in our future episodes. And you can book my services at poneahealth.com.